type the word mansplaining and whatever insults you're going to do and get it out of your system. This is what a crisis looks like on women's bodies. I misinterpreted what the title was about. These are people body shaming other people who are going through medical situations or trying to compensate for something that's medically going to kill them. These happen to be, if you're not aware, I'm going to explain some reality to some of you out there that are constantly, chronically, it's mostly women I'm seeing in this video, but it could be men and women. You judge everything about a person based on their appearance, and you need to own it. Every fucking one of you that did a video like this, and this channel that uploaded the video, I don't know that they had it, is Rhea. I don't know that this person's actually saying these things, but they're repeating a bunch of shit from TikTok being played back. It's very obviously TikTok shit, because it literally says TikTok on 80% of this crap. By the way, uninstall TikTok and stop this shit. Years ago, people were complaining that people were giving body positivity by saying it's okay to be, you know, literally obese or skinny or whatever. But the undercurrent was that you couldn't be a certain thing and talk about it, because it has to be one or the other or some other damn thing, and it's on an Etch-a-Sketch and nobody listens. Okay. Some people who see my channel will refer to me in all sorts of ways simply because of the way I do lighting here or the lack of it, and have tried to body shame me. Let me clue you in something. I'm over 55 and I'm not dead. Most of what you're seeing right here is regrowth from damage. Damage, some of which I haven't explained to anybody. Let's not even go into what happened below my neck with every part of my anatomy. Parts of my hands have gone through things to where they shouldn't be still here. Part of my leg, both feet. I've almost had my legs cut off twice now. Yeah, and then the insults will pile below because you won't listen to the following. As you grow older, you find out something important. Most of the people that are being evaluated, most of the women that are being evaluated by primarily other women, are rich women who can find out, oh, I have a medical problem. I can just throw money at the problem. Yes, money doesn't buy happiness. Yes, it fucking does, because it eliminates misery if you do it right. As long as you don't allow the money to tell you that you can solve every little dinky problem that isn't that damn important by throwing too much money at it. Don't get a facelift. Don't. Get every mole and every potential future melanoma removed. One of them they were evaluating is Ariana Grande. Isn't she a woman who has a chronic medical problem caused by having to have, like, I think it was kidneys dealt with? So, at her young age, going through a major medical challenge and hitting a milestone years ago that apparently a lot of you forgot, she's now going through changes in her body that probably require medical attention, like the rest of her time. And the first thing out of people's mouths are that you shouldn't be able to see collarbones. And they shouldn't stick up like this. The fact that this is still attached within a quarter inch of where it was before it was ripped loose the last time I had something happen to me is a godsend, because I can move my arms. The rest of the joint's anatomy is damaged because I'm poor. I don't even want to know what you say to people who don't have enough money to hide this shit. Anybody remember when Angelina Jolie came out of the closet of having to be a brave woman and say, yeah, I found out that I have a genetic predisposition to die from cancer, so I got a bunch of medical work done, and all of you catty cunt balls out there went after her and said, you did, and then, no, you're mad because she's rich enough to prevent her death. Oh, does that sting? Does that hurt? Well, rub a little calcular venom in it so it amplifies it. Pain amplifier. I want every one of you to feel like a piece of shit because some lady tried to prevent her own death from fucking cancer by getting a bunch of medical work done simply because she had enough money to throw at the problem to prevent her death. Body positivity has to be about, you know, whatever you say it is. But if it's about something you don't like personally, you assholes out there go after these people and won't let the fuck up. And every one of you watching, if any of you forward this to someone, hey, I will let you clip the video you're watching and remix it. Just don't change what it means. I don't do that with my videos. I want you to tell everybody to stop following every fucking one of these people that gives their goddamn opinion about someone they know nothing about. They may be going through who knows what. They brought up women who are, oh, they're all at the an awards show or whatever. And on and on. These are rich people, usually older women who happen to look good because of whatever you want to complain about. But they have money and they can get away with preventing their own death, which means at every opportunity, if something medically is about to happen to them, unlike the rest of us proles, they just do what the doctor tells them to keep them from having a medical problem 10 years down the line. If that means that they found out, oh, I have chronic central obesity-induced chronic heart failure because there's too much matter around my heart, that's an actual thing. There's a medical treatment for it. It's called going under the knife, and what they do is, well, it's fat reduction. No, it's preventing their heart from being strangled by too much material around it. There's a genetic predisposition some people have of forming a layer of not fat, but fibrous material, basically protein or tendon material over their heart that slowly kills them. So what do? Well, if you're poor, you die. If you're not poor, you get the stuff removed every couple of years. Yeah, it's major surgery because people don't want to die. So you look at almost all of this are people who are rich enough to go in and, well, they can get a tummy tuck or whatever, but they can also go in and get, revascularization. That's where you rebuild the blood vessels so you don't lose your legs. Not that I know anything about this. A long time ago, I made enough money to be able to pay off a bunch of things at once because I asked the doctors, how do I fix the problems that are killing me right now? Period. Just answer. Don't talk. Don't hem and haw. Don't rationalize. Don't bargain in your head because doctors are taught to just not tell you the truth. No, I'm not kidding. All you have to do is say to them, bring the price list, otherwise known as the fee schedule for each procedure. They won't do it. It's a fixed pricing. It's price fixing. They are not allowed to talk to you about it. Doctors lie to every fucking one of you. They know exactly how much it costs to do every procedure, and they lie about it because it's the cost they have to deal with. They want profit, and they don't want you to know what the baseline cost is. And the funny thing is, they're legally required to tell you what that price is, and then they just avoid it. But anyway, get a doctor to shut up and just listen to the following. Like I did with this doctor. I want you to tell me each procedure that I need to go through to make it to where I can't have this happen again medically for the rest of my life, no matter what the consequences are. I don't want to go through this again, losing my legs, potentially. And I want you to stop lying to me about the cost. I want you to know the baseline cost, and I want you to tell me the actual percentage at the end of the whole process that they want in each one of them. What's the actual amount of money? Please stop bullshitting. And I kept repeating, I am not going to give you information about an insurance company so you can tell them that, because that's private information between your doctor and your insurance company. No, it fucking isn't. And the doctor actually fessed up that it was insanely cheap if I just paid up front. And again, give me the goddamn numbers. So I built up the money and had them go through and literally remove every bit of scar tissue in my legs and every part of my body. Well, you win it. I prevented my death. Repeat. When you say these skinny bitches on the runway prevented their death because they're rich enough to do it. Every time. Prevented their death because they could afford it. Rich enough not to die. That's what you're complaining about. Because tacitly and subconsciously, every one of you people bitching about people being, they're too skinny or too hot, or that's what Hollywood wants. No, you're looking at people who are not like the rest of us. They are rich. They can afford to go in and prevent their death. I'm going to keep saying prevent their death. Yeah, but I'm not talking to you, the idiot that doesn't listen. I'm talking to every one of you that's going to repost this or recut this video. I don't care what you do. Just do it. When you body shame a person for preventing their death, you're an asshole. That's it. I don't want to hear it. A famous singer who used to sing a song about body positivity recently went through a huge weight loss. Well, that doesn't look healthy. Guess what? It's like the joke. Why would a person in their right mind do XYZ? That's because they weren't in the right mind at the time. Why would someone go through all that body-changing stuff? They look medically screwed. Because they were medically screwed, that's the outcome, and they're healing from it. I forgot her name. It's slipped my mind right now. But she did a song, Body Positivity, blah, blah, blah. Now she's skinnier. Yeah, because on a medical basis, if you're not aware of it, Something happened, and she's simply not sharing it. Why? Because, again, there was a lady, again, years ago, again, she's a famous actress, loved her in the movie Hackers. She had to do something medically drastic to prevent herself from dying from cancer. Because they had precancerous cells they were able to detect and genetic predisposition for them to be there, and the only way to make sure she didn't die from metastasizing cancer that'll kill her deader than dog shit was to get a bunch of tissue removed. And y'all decided to judge her. Why in fuck would, again, this vocalist tell you why she lost pretty much 80% of her fucking body weight? A lot of you are claiming it's about half. She lost 50% of her body weight, it looks like. But I don't know. It's not my business. Neither is it is yours. LabTech, you went in and got, and then you're going to claim I did a bunch of stuff a long time ago when I actually had money, and then I ended up being, you ended up homeless, but you had money and blah. You're going to make up that kind of bullshit in the comment section, right? Or I was able to get a doctor to stop lying to me because I kept saying, I don't have insurance, you can't jack up the prices, this is not a profiteering moment. And they finally told me the real cost, and I paid the real cost plus 25% so they wouldn't lose any money at the hospital. Because the hospital is legally required, if you fucking get a court order, to tell you how much they charge for things so you can get something done. It's pulling teeth, quite literally. My procedures that I have to do still include getting a bunch of ligaments and a bunch of muscles reattached where they were. I couldn't get that done because it was too expensive. I got what was able to be done with the jack shit of money I could collect. Meaning I worked injured with dislocated and disconnected parts and just had them put together to give me the level of mobility I have right now, where as long as I don't do certain things, my shoulder doesn't come out of socket, or my hip doesn't, or my knee doesn't flip the wrong direction. My knee can bend the wrong way. I don't even want to bring up what my ankles do. I'm functional enough, people can't detect that I'm not functional. I was considered 50% disabled at one point. I'm not now. And no, it doesn't help me to show disability and get what are you going to say? I'm going to be getting government payments for. No, that's not how the real world works. That has never been how the real world works. Some of you out there will grasp at every fucking thing to ignore reality. Again, let's repeat it. Angelina Jolie got treatment to prevent her death because she simply had enough money to get away with it in this world, where insurance companies and everybody else have driven it up to an unbelievable cost. And a bunch of people were mad at her because it changed her fucking appearance, or they thought that it was a slap in their face for some reason. And some of you might get mad at me that I took the last of my savings that I built up by being a computer geek for several years and spent it on making sure that my spine wouldn't break and I wouldn't end up paralyzed, or that I wouldn't lose my legs, or I would have an arm that didn't have to eventually be amputated because it was pulling the blood vessels too thin. I didn't get my scalp revascularized, I would have hair now. Because revascularizing my face was a little more important because my face was going to fall off. Yeah, but there is no yeah, but. Well, there is no well, it's run dry. Unless you know a person's entire medical history, you don't know what they've gone through. And even when you do, some of you people still attack people for doing something that you would do in a split second if you had unlimited funds. And let me tell you, the movie industry is a fickle bitch. Oh, I have money now, I'm going to get everything fixed. Because I can. I can't when I have no money. It's money. Yes, money does bring happiness, as long as you don't throw it away on doing stupid stuff. And yeah, there's still some debate about Michael Jackson getting a lot of his face redone simply because he got burned one day. And then he found out that that would cause permanent, recurring scarring issues that had required every couple of years of maintenance. And then it just turned into something a lot worse. But we don't know that. Again, these people had privacy at one point, right? Don't you? So yeah, when I see people going on being, the word that most people use is catty, complaining about other women, usually these are women, but not always, and they changed their appearance, and you have something to say about it. Ariana Grande, with a continuous string of medical issues, wouldn't possibly have gone through something medically so devastating that it would drop her weight. Or maybe they're just using Ozempic because it can physically force their body to drop weight so they can get something else fixed. That's all I got to say. Thanks for watching. Have a good day. Good luck with that. This was a rant. Nothing more. Bye.